Hi, I'm Dr. John Young with Foundational Health Center here in St. Petersburg, Florida. And today we're going to talk about a subject that is always difficult to talk about, and it's with the dealing with cancer. I'm just going to share what I do here at this practice, and if this is helpful, great. If not, that's fine. But anytime you're dealing with cancer, I've had several patients in the last few months where I got the results back and I had to actually tell them, you have cancer. And when we hear that word, it's kind of like everything shuts off. I can talk for an hour, 2 hours to the patient, and they won't remember a thing that I say. Because once you hear that word, you're just like, am I going to be dead tomorrow? Oh, I'm going to lose all my hair. I'm going to be sick as a dog. Will I live till next Christmas? Everything kind of goes through the head. And so what I'm trying to do in this time together with you all is show you that the diagnosis of cancer has completely changed. The treatments have completely changed in the last 5 to 7 years. And unfortunately, a lot of doctors don't even know that. A lot of oncologists don't even know that. But what I want to say first is this. When I tell the patient they have cancer, I want to give them hope, and realistic hope. So I may not say too much the first session that I break this to them, but there's going to be some things that I do right off. One is basically their immune system let them down. Let's say 10 years ago, as they were out playing tennis, some cancer cells showed up, the body didn't deal with it, and the next thing you know, breast cancer starts growing, and after a few years, it starts to show up and we can make a diagnosis. So I want to make the immune system better. I check the vitamin D levels, D as in dog. I want those levels over at least 60. You need a level over 60 of vitamin D just to help with cancer prevention. So I will get the vitamin D levels up. Number 2, I get a fasting insulin, not a glucose, an insulin. Because patients that have high insulin levels, it shows a couple things. One, the immune system is depressed, and you don't want that. And number 2, cancer cells love insulin. It's like fertilizer to a cancer cell. We know that diabetics who are on insulin, they never do as well with cancer treatments because the insulin is always there encouraging the cancer cells to grow. So I lower my insulin levels by increasing protein. Or I've also done this, I fasted them. And yes, believe it or not, there's some interesting studies out there showing that when you fast a patient, and I mean just basically water, could use a little bone broth, but when you fast more than 3 days, the growth hormone levels grow up, increase, but the immune system gets much more sensitive. It gets stronger. And really, what cancer is, it's a failure of the immune system. So fasting may be an option, and you might talk to your doctor about that. But if you're not going to fast, you need about 1 gram of protein for every 2.2 pounds of body weight. And if you get that, then insulin levels will also drop. So right off from the beginning, I really encourage the patient to look at their vitamin D, get that up, and get the insulin levels down. Now, doctors don't seem to understand this. The general public doesn't seem to understand this. But about 7 to 10 years ago, everything changed here in the U.S. in the treatment of cancer. Because a few years ago, the US FDA and the European FDA did a reciprocity agreement. So it's approved, if it's approved by the US FDA, it's allowed in Europe. If it's approved by the European FDA, it's allowed in the US. You can do it legally. I think Europe is far ahead of the US when it comes to cancer treatment. Here in the US, we've made cancer more of a, we're going to fit you into our treatments. And in Europe, it's more, no, we're going to treat only you. We're going to make everything we do only for you, your genetic markers and all of that. So European treatments are more patient-specific, and American treatments are more group-specific. I think a good example is there's a certain type of breast cancer, and there's 3 main categories of that cancer, A, B, and C. So what they've done is they've made treatments for, they diagnose this type of breast cancer, and then they say, hey, this cancer is closer to A than B or C, so we're going to use this type of treatment on her. For that same breast cancer, they've found 139 genetic variations of that one cancer. So having, just 3 options for a cancer that has all kinds of genetic variations may not be so good. The Europeans are more, they will take that breast cancer, look at its genetic markers, and make the treatment just for that genetic marker on that cancer. So it's much more specific. So that is the option that patients have now. And that's what we've been doing here at this clinic. Been very pleased with our results. To show you, in the US, at one of the large cancer centers near my practice here, they have a stage 3 and 4 cancer. Their 5-year survival rate is about, of all their cancers, is about 30%. The European is about 75%. Big difference. Group treatment versus individual. So with a lot of my patients, they're very alternative minded. And they say, okay, all right, John, all right, you've told me I have cancer. I'm going to go out and I'm going to do turmeric and Estiac and shark cartilage and IV vitamin C. And they ask me my opinion, and I say, hey, that's great, but I don't know if it's going to work on your cancer cells. You see, I have a person comes with a urinary tract infection. I can give them Cipro, but what if their organism is not sensitive to Cipro? What if it's only sensitive to Keflex? So we now have the ability with cancer to find out what your cancer cells are sensitive to. It's called an Oconomics Plus test, where we draw your blood, we send it off to a US FDA approved lab there in Europe, and they will grow those cancer cells out. They'll tell you how many cancer cells you have per 7.5 mLs of blood. They will then tell you what your cancer cells are sensitive to chemo-wise, if you want to go chemo. But for my patients, it tells me what they're sensitive to alternative-wise. And you can also send three things that you would like them to test against your cancer cells. And so I had a lady who has breast cancer, and she said, listen, I'm going to take turmeric. My neighbor, she had breast cancer. She's done turmeric. It's worked wonders for her. So we did that test on her. None of her cancer cells were sensitive to turmeric, nothing. So she said, well, why would I spend my time and money taking turmeric? I'm not going to do that. We found that her cancer cells were sensitive to 6 other products that they had tested out there in Europe. And so we put her on those. And it's very interesting. Every patient that I've done that with, I've seen the cancer cell number per 7.5 mLs of blood go down. I think she started around 7.9 cells per 7.5 mLs of blood. Then she went down to 6.9, 6.2, 5, so on. Because you want to get less than 1. But I like that test because it gives me a roadmap. I can guess, if I was really good at guessing, I would have won the lottery. There are so many products out there, you're going to go crazy trying to, first of all, you don't have enough money to buy everything out there that's supposed to kill cancer cells. Just because it kills cancer cells in a laboratory dish does not mean it's going to kill your cells. The other thing I like about that test, the Onconomics Plus test, is this. It tells you what your cancer cells are doing right now. I have a gentleman with prostate cancer, and he's seeing me and also seeing a large cancer center up in the Northeast US. And they told him, you know, Bill, your prostate cancer is fine. It's stable, nothing's happening, everything's fine. You know, you're in remission. Well, we did that test on him and we said, hey, your cancer is not good. You have 8 markers here that are telling us that your cancer cells are building blood vessels. When cancer cells build blood vessels, what does it mean? They're getting ready to metastasize, to move out. See, the interesting thing about cancer is this. If cancer just stayed right there in the breast or the prostate, no real big deal. 95% of people who die from cancer die from the metastasis, where the prostate is spread to the bones and then to organs, or the breast cancer spread to the liver and the brain, and that's what kills them. It's the metastasizing of these tumors. Chemotherapy, radiation, even surgery. It can remove those cells or kill those cancer cells, but the thing that determines whether it's going to metastasize are the cancer tumor stem cells. That determines really how long you're going to live. And I've talked to the oncologists, and they've said, no, our treatments don't touch the tumor stem cells. And that's what one of the things you want to ask your doctor is, this treatment, you know, is it going to do anything with the cancer tumor stem cells? Because that's what's going to kill you. A good friend of ours, well, excuse me, let me go back to the gentleman with prostate cancer. So he had 8 markers that showed that his cancer is starting to build blood vessels to move out. He also had a number of other markers that showed that his cancer cells are just growing as fast as they can divide now. They've lost this ability of apoptosis, self-destruction. They can't turn themselves off. They just keep growing and growing and growing and growing. You see, the Americans use about 6 markers in following cancer. The Europeans use 109 markers. I get so much more information so much earlier. And even one of the large institutions here said to me recently, man, John, you're far ahead of us when it comes to detection of these cancer cells and what they're doing. So that Onconomics Plus just gives me a lot of information and tells me what's going on, what's going to work on those cells, both the cancer cells and the cancer tumor stem cells, and tells me what I need to do to help reduce the apoptosis or increase apoptosis so the cancer cells will kill themselves, and what I need to do to prevent angiogenesis so we're slowing down the metastasizing rate of these cancer cells. So it's a great roadmap in dealing with cancer. The other thing I think that's also interesting is this. It does save patients money. I've had patients come in and the whole desk is filled with all these pills that they're taking. And they're spending $1,000, $1,500 a month, and they don't even know if those pills are working or not. So check with your doctor. Check about getting an Onconomics Plus test. It's a great test. I think that's where you need to start when you're looking at cancer treatments. The other thing is I have patients that will go ahead and do chemotherapy or whatever, and I can give that information to their oncologist to show what chemotherapy would work best against their cells. And then I'll also give the other information so the oncologist can see very quickly, oh, this treatment isn't working as well as we thought because you're getting ready to metastasize. So whether you do natural or you do chemo, radiation, whatever, there's great information that you can use to get yourself better. Because who's responsible for your health? you're responsible for your health. Not the doctor, not the big cancer center. You are responsible for your health. And you need to be proactive, especially with cancer. I'm thinking of a good friend of mine who about 5 years ago diagnosed with melanoma of the neck. And he went to the big cancer center. He did do some IV vitamin C with us, and it did help reduce the side effects of the chemotherapy and all that, and recover from the surgery. But the center did extensive neck surgery, and they couldn't find a single cancer cell. They got it all. And about 4 months ago, he went for his final 5-year scan. He said, John, it's been great and I've been following the scans the center's been sending to me, and they're all negative. You know, that's been great. And that last scan, there it was. He now had 2 brain tumors. And really, really disappointed. I was disappointed because, you know, our families know each other. My kids go to school with their kids. And what was also sad is he had all these scans that said he's fine, but his treatments never dealt with the cancer tumor stem cells. And that's the one that causes metastasis. So I think it's something that you really need to be on the lookout for. And if you're going to do regular chemotherapy or radiation, ask the doctor, are these going to kill the cancer tumor cells, or what are you going to do about it? That is key. What are you going to do about it? There's a number of options that the Europeans have come up with that I think are just great. And when I talk to doctors here, they always say, you know, well, John, you know, we have big studies that show that we did this treatment for 10,000 people with this type of breast cancer, and here's our results. And I tell them I can't do that because you are using 10,000 women and giving them these 2 drugs. And then you're going to see how many are alive after 5 years. I am taking 1 patient and I'm treating only their genetic markers for their cancer. And I can't give that treatment to another person because that would not be ethical. So I can only go 1 person at a time because each person is different. Each treatment is going to be different. It's so personalized. So in talking to these patients, I have to explain that to them. And when they talk to their oncologist, they need to, you know, be aware of that. But it's interesting, the personalized treatment has about a 75% 5-year plus survival rate for stage 3 and 4. The American model, about 30%. One of the treatments that we can do, that Europe now has provided to us, that we can do here in the States, is just called kind of a tumor vaccine, where we take blood and send it off to the lab in Europe, and then they make a vaccine for those cancer cells. Kind of like with polio, you can make a vaccine from the polio organism. And so you're making a vaccine for that vaccine to go right to those cancer cells. So a person that has a very large burden of cancer cells, that may be an option to do with the cancer vaccine to help reduce that load. Number 2, there's a dendritic cell vaccine. Dendritic cells are part of the white cell blood system, immune system, and you jazz them up and they will raise all these immune levels. Your immune system raise it way up and let the immune system go after the cancer. And that's worked very well. Another option is called SOT. I won't say the big word, but just SOT therapy. You can look it up. And basically what they do there is they draw your blood and they can look at the RNA in those cancer cells because it's in your blood. You can have breast cancer and I can draw blood from your arm and I'll get those breast cancer cells because they're already through your body already by the time it's diagnosed. They grow those out and they look at the RNA because that's what the cancer problem is. They take out the defective genes, put in the corrected genes, send it back to us, and we give you that. And that has worked very well. It's about a 2-year process, getting several shots, 3 or 4 a year for about 2 years, but very, very successful. That's kind of the gold standard when it comes to cancer. The US version, SOT, is more of a, we're going to develop SOT shots for, let's say, adenocarcinoma of the breast. And they say, well, there's 3 main adenocarcinomas of the breast, A, B, and C. We'll make an A, B, and C vaccine or shot for all of those. And what the Europeans said is, well, you could do that, but we're going to treat each person as an individual, and we'll make the SOT treatment only for that person. Group in America, individual SOT in Europe. The American price is unbelievably expensive. The European price is very, very reasonable. So the thing is that we are just right for that patient's cells. And then we follow it with the Onconomics Plus. And as long as we see that cell count number going down, we're fine. But all of a sudden, if it goes up, we know the cancer cells have genetically changed. And that's what you see here in America also. Hey, I'm doing the chemotherapy, radiation, cells are, all my numbers are looking good, they're going down. And then all of a sudden they gave me this last chemo and my numbers went up because the cancer's genetically changed. And now they've got to find a new treatment. So when it goes down, keeps going down, we're fine with the SOT, but if they start to go up, the cancer cells have changed genetically. We go back in, draw your blood again, make those new corrections in the RNA and give it back to you, and then we follow as it starts to go down again. But it's being on top of it, and we do it about every 3 to 4 months. Here in America, they kind of check maybe every 6 months or whatever. We like to do it a little more often because we want to be right on top of anything that's changing. The other nice thing about SOT and the immune system and the other vaccine is this. The dendritic cell and the tumor vaccine is you're really not sick. I think what scares a lot of patients with cancer treatments is I'm going to lose my hair, chemo could be so strong it may actually kill me, I'm just going to be miserable. For a lot of these treatments, you get it and you go out and play tennis that afternoon. Because it's specific, it's just for the cancer cells. We're not killing hair cells, wiping out the cells in your gut, damaging the nerves or your neuropathy or your heart or whatever. It's specifically for the cancer cells. So I'm just trying to give people out there encouragement that there's some great new treatments that are FDA allowed now in the US because of that reciprocity agreement between Europe and the US. And you can do the American model, which is more group, or you can be very specific just for you. But you have great options, and be sure to check with your doctor because you may want to look at some of these other options. Take care.